Hello, good morning. Myself Dr Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the hip joint biomechanics and we're talking about the muscles of the hip joint. So next muscle is hip extensors. So these are located in the posterior, that is back side of the hip joint, and the hip extensors are the gluteal maximus and the hamstrings. And hamstrings consist of semimembranous, semitendinous and biceps femoris. And the next is the hip adductors. So hip adductors are mainly the adductor externus, adductor brevis, adductor longus and adductor magnus. Next is the abductors of the hip joint. So abduction is done by the tensor fascial artery, that is TFL, gluteal medius and the gluteus minimus. Next are the hip internal rotators and the external rotators. Hip internal rotators is done by the gluteal medius, TFL and the gluteus minimus, and the external or later rotators by gluteal minimus and the maximus. Next is the blood supply of the hip joint. So as this figure represents, the main artery of the blood supply is the femoral artery, which is changed into the profunda femoral arteries, and in later it changes into adductor hiatus. So hip joint is mainly supplied by the branch of the femoral artery, that is lateral circumflex femoral artery and also medial circumflex femoral artery. So vascular supply of the hip joint is primarily through the branches of the obturator artery, medial and lateral circumflex femoral arteries, superior and inferior gluteal arteries, and first perforating branch of the deep arteries of the thigh. And the articular branches of these vessels form a network around the joint. Thank you.